Hello, everyone. I'm just waiting a little bit for everybody to come in, but it is a pleasure to see everyone. I'm just going to give everyone about a minute or so just to log on. I know that you guys are probably really excited now that you're having your babies. I'm really happy to meet you all. My name is Rachel. It is a pleasure, and I would just like to start off by just introducing myself. So I'm a maternity nurse. I've been a maternity nurse for about 8 years. I've been doing these classes for about a year now, and I absolutely love it, especially with all the craziness of COVID. It definitely helps to have a little resource that you can pretty much rely on, and we can all support each other in this. So I've been doing these classes for quite some time. I absolutely love them. And if I can just hear who you guys are. So you can say maybe your name, where you're from, and maybe how many weeks you are. That way also I can kind of see what everybody needs individually. So my name is Rachel, like I mentioned before, but I'm from Florida. I actually have 2 kids. I have a 2-year-old, and I also have a 4-year-old who's actually about to be 5. So very exciting for that. And I am going to give everybody just another minute as well. There is a chat box on the screen as well. This is a YouTube stream, so you'll be able to use the chat box to pretty much discuss, answer questions. This is a great way that we can kind of learn from each other. And then, so we'll start off. This is the second part of my class, but you can pretty much start off anywhere. Last week, we did talk more about childbirth. We talked about pain management. We talked about different things to expect when you enter the hospital. Today, I thought it would be great to talk about something that a lot of people don't really discuss too much, especially medical professionals, and that's postpartum care, how to take care of yourself after you deliver as well as your baby. So I also have a lot of resources on mommydidyouknow.com. If you look at the description on this video, you'll be able to see the link to sign up for my free prenatal class, which is actually online, and it's 4 days as well. And you also have links for a few other things also, and along with links to sign up for the next class that we have. So it is a pleasure to meet you all. So 37 weeks, 30 weeks tomorrow with your first child. Most people do end up, and I think we had Jessica, your name sounds familiar in a previous class. So it's fantastic that I think we have some, unless we have people that have the same name, which is cool too. I mean, I figure we would probably have some people with the same name, but most people do end up taking this class as they start getting closer to delivery. And you can take this class. Oh yes, I do remember you. So good. And you can take this class as many times as you want. So theoretically speaking, you can be a part of this class every week until you deliver and get all of your questions answered if you want. I mean, in the end, that's what I'm here for. So last week we did talk about childbirth. We talked about pain management. So now our baby is here, and we have mom there, possibly either vaginal, cesarean birth. And I want to go over how to take care of yourself, whatever direction you have, whether you're a vaginal or if you are a cesarean delivery. So what to expect after delivery. And I know that a lot of people, they always focus on baby, what to expect for the baby, but they don't really focus on what to expect for mommy. And it's very important that you know what to expect. Number 1, shaking. Shaking is to be expected after. If you think about it, all of that fluid, you were filled with fluid before, now all the fluid left your body. You still have some, in your system, and it's going to circulate, going to get out, but all of that fluid imbalance, hormone imbalances, it's obviously going to cause some shaking. Warm blankets, hydration really help. Usually you'll have some fluids after you deliver as well. That will help you with the shaking. Warm blankets really, really help. And then of course, skin to skin. Skin to skin is one of the best things you can do after you have a baby. We have postpartum contractions are also to be expected after. And one thing that a lot of people don't realize is that with every baby that you have, your contractions actually get a little bit stronger. So let's say with your first baby, you did not really have that many contractions. Your second and your third baby, you might actually have a little bit more. What I noticed with With mine, my first baby, after I delivered, I didn't need Motrin. I didn't need anything. With my second baby, oh man, like I had him right after, we're breastfeeding. And then all of a sudden I start getting those really big, strong contractions. I'm like, oh man, where did all of this come from? And I actually noticed a big difference in that. It's because the uterus kind of has to work a little bit harder to get back to its original position. So some postpartum contractions are to be expected. You can try warm compresses there, you can try Motrin, but one of the best things that I normally recommend is actually to empty your bladder, especially if you are cesarean delivery. If you are having a cesarean birth and your bladder's too full, it'll press against the uterus and cause you to have a lot more pain on your incision site. So that's why I always recommend try to empty your bladder as soon as possible. If you had a cesarean birth, you're probably going to have some effects of your anesthesia that you won't be able to walk. You'll probably have a catheter for a little bit. But once that catheter is removed, try to pee as quick as you can, just so that you are emptying your bladder, and frequently as well. Next, mood swings. Now, who can tell me the difference? I know we have a few people here. So Jessica, Samantha has been active so far. Who can tell me the difference between baby blues and postpartum depression? Now, this is very, very important to understand, because a little bit of baby blues is to be expected sometimes after you have a baby, because, there's changes. You have changes to your home dynamics, changes to your relationship dynamics, even if you have other children, what to expect. Even in terms of if you're used to doing certain things like hanging out with your friends or something, and these things start to change, of course, sometimes you might have little mood swings. You might have a little bit of baby blues. So the difference between baby blues and postpartum depression, we'll talk about it a little bit more also, because it's very important that you guys understand, is that postpartum depression also gets in the way of daily living. Postpartum depression, just like any other depression, is something that you can't really get out of bed in the morning. Sometimes, you might get out of bed, but it's just these thoughts are constantly in your head. And then they also sometimes even have thoughts of hurting yourself or your child. So of course, if you have any thoughts of postpartum depression or even baby blues that seem that they are a little bit too intense, you definitely want to get checked out. You can talk to your OB. Usually they'll be able to refer you to somebody to see. Baby blues is also a lot more shorter lasting, and they tend to be very situational. Like, let's say you'll have baby blues because your baby all of a sudden is having a hard time breastfeeding. You went back to work, 6 weeks after, like I had to. Let's say you went back to work 6 weeks postpartum, and you come back, you want to breastfeed your baby, and they're starting a breastfeeding boycott. You might have a little bit of breastfeeding blues. It's very situational. It's very short-lived. Once you start that transition, everything starts regulating, usually gets a lot better. With postpartum depression, it usually starts out slow, but it never really quite goes away, and it's not quite situational as much as baby blues. Then another thing to look at as well is period-like bleeding. So you definitely want to let your doctor know if you have big blood clots coming out, if you fill your pad in an hour, or have any concerns about your bleeding. Of course, everything that was inside you somehow is going to have to make its way outside of the body. So you will be expected to have some lochia, which is called period-like bleeding. Now, as a nurse, I kind of always have this joke, but I'm like, one thing is we always have to introduce ourselves in the morning. I'm like, all right, hi, my name is Rachel. I'm going to be your nurse today. Let's spread nice and wide so I can see how your bleeding is, but that's one thing that's very important is our nurses. We have to make sure that your bleeding is under control, because sometimes it's not always something that you can feel. Sometimes you can feel it, but definitely you would want to change your pads every, 2 to 3 hours max. You don't want to let that pad soak for too long. And then if, let's say you go to the bathroom and then an hour later you look and your pad is completely soaked, that's definitely heavy bleeding. You want to let your doctor know, you want to let your nurse know what is going on. And then big blood clots. I know that's kind of, you're like, big blood clots, how big is big? So it's normal to have like little small blood clots. If you think about it, it's the same thing when you go to, let's say you have your period, you're sitting down for a long period of time, and then you stand up and all that blood was coagulating. When you stand up, that comes out as little blood clots. So that does happen, especially if you're sitting down for a long period of time. But if they come out like golf ball size of your fist, that, however, is not very common. And you want to make sure that if, let's say you go to the toilet and one big one just drops, I would leave it in the toilet and let your nurse see it. Just make sure that it's okay. Sometimes it's perfectly fine, and sometimes it's something that we can give you medications to help with your bleeding. So these were just a few things of what to expect after delivery, so you're not completely surprised after and you're like, what do I do? Now we have postpartum hygiene. This is important because UTIs and yeast infections are pretty common after you have a baby. So one of the best ways that you can prevent UTIs and yeast infections is simply by having good vaginal and postpartum hygiene. So for vaginal care, you want to change your pads every few hours. We just did mention that, but definitely every 2 to 3 hours. You don't want to be sitting in old lochia or old blood for too long. Try to pee every 2 to 3 hours as well. You can even use, most hospitals do give you this kind of plastic water bottle that you can fill up, and you can use that as well. Use the peri bottle until you stop bleeding. You can even take that bottle with you and take that bottle home with you. You can use it, and actually until you stop bleeding is good too. Sometimes they even have these wipes that you can use also. I mean, it's whatever floats your boat, whatever you feel comfortable with. And then you can also use perimeds such as Dermaplast and Tux pads. They usually have these in the hospital, but you can also buy them in CVS or Amazon. Actually, Amazon, if you are going to deliver, Amazon has Dermaplast, they have Tux pads, and it's a lot cheaper than going to CVS. So if you have Amazon Prime, I'm a big Amazon Prime person, Dermaplast Tux pads are very good for just to help you out with any pain. And nothing in the vaginal area for 6 weeks. That includes tampons. So although you are having bleeding and normally you might use tampons as you have your period, you do not want to use tampons after you have a baby. Pretty much you want to make sure that you have pelvic rest for at least 6 weeks, and that includes intercourse. Another really interesting fact as well is that it's also recommended not to have a tub bath or go swimming for 6 weeks also, just because all that stagnant water that's not really moving can cause infections. So nothing in the vaginal area for 6 weeks. Try to have as much pelvic rest as possible. And then yet again, make sure to call the physician if heavy bleeding were to occur. If you were to have a postpartum hemorrhage, I know that a lot of people, they're like, okay, what happens if I have a postpartum hemorrhage? First thing that they'll probably do is they'll probably hang some Pitocin. So Pitocin, when you are being induced, is to cause, those contractions, is to cause the baby to come down. What the Pitocin does after you deliver, and you always have a right in terms of your medical treatments, but this is just what most people do in terms of their medical treatments for postpartum hemorrhage. The Pitocin after helps to keep the uterus nice and firm, therefore helps to decrease that hemorrhage. And then you might even have something called a methergin, which also helps to decrease the bleeding. You might even have Cytotec. These are different methods and medications. Methergin's usually given by muscular injection, and Cytotec is usually given rectally. So these are all different medications that you might see if you were to have a postpartum hemorrhage. By the way, I do offer consultations, and it's highly recommended if you guys are getting closer, especially Jessica and Samantha, you guys are into your 3rd trimester, and who else we have listening. I also do prenatal consultations, and although I am a lactation counselor, I'm also a nurse, and I do work labor and delivery as well as NICU and nursery. So I normally recommend a consultation before you deliver, that we can go over all of this and more, because we can go over your specific needs and what you specifically will be going through. And in terms of even if you are delivering early, if you have blood pressure issues, if you have sugar issues, all the more reason to have a nurse to have a little consultation before. And actually on the description, I have now free meet and greets that we can, it requires absolutely no credit card, no money at all. If you click on the link in the description, it'll actually have the link to sign up for a free meet and greet. It's just, a little phone call that we can go over any preliminary questions that you might have. And then we can also develop an educational plan based on what you specifically need. So that's in the description for the free consult along with the free prenatal class. So all of those are in there and they're absolutely fantastic. By the way, in the end of this class, I have a few people in this class already. I'm very happy to announce that I will be giving away one of my premium childbirth masterclasses as well. So it's a wonderful class. It's like a month-long class. So you'll be able to get it absolutely free in the giveaway that I'm going to have in the end of this class. All you have to do is stay active, be in the discussions, and then answer the questions that I have in the end. We'll have a little test to test your knowledge and everything. And then one lucky person will gain access to the class. So we talked about vaginal hygiene after a delivery, but also it's very important to learn how to take care of yourself if you were to have a cesarean birth. So incisional care, one is you may shower. Although they say not to have a tub bath, you can still shower. When you shower, if you have a cesarean delivery, what you can do is just make sure that the incision site is clean and dry after, so you can still shower like normal. When it comes to cleaning the incision site, you can pat it instead of scrub, and you don't want to have any soaps that have too much scents or even like those exfoliating beads. You want to kind of stay away from those in the shower. You want to make sure your incision site doesn't really have anything that can cause infection. And then when you're done, you just towel dry. And then what I've seen some people do, because some people after they deliver, they still have that little, mama pouch going in. I still have a mama pouch and I've had my last baby almost 3 years ago. I guess it happens to some people. But if you still have a little mama pouch going on and you want to have a little something on top of your incision, sometimes once the dressing is removed, you can even put a peri-pad, like the same pad, like a Kotex, and put it on top of the incision. If you're having a lot of overlap and you want to make sure that it stays clean and dry, you can do that as well. Use of an abdominal binder for support is recommended. Usually they do give you one in the hospital. If they don't, you can request it. Usually they have one. Some nurses give them, some don't. I personally always give my C-section patients abdominal binders just because it really helps them to get up, get moving. It really helps to support your incision. Now you wear it kind of like a waist trainer. It's not really like for your tummy. It's not to hold the tummy in, although a lot of people use it to hold the tummy in, but it's actually to support your incision. Think about if you are coughing and you have pain in your stomach, you would kind of want to splint your incision as you're coughing. So it's the same thing with an abdominal binder. It is supporting your incision so that you can walk around a little bit more freely. And then call your physician if drainage, foul odor, excess swelling, anything like that were to happen. And then you may have staples, surgical glue, stitches, or steri strips. Steri strips are amazing. I love them. Usually what you'll find is, every doctor is different. So that's one thing you can talk about your doctor to your doctor. But usually the staples go on first, although, every doctor is different. You can talk about it with them, but they'll suture inside. Some people will have staples on the outside at first, and then they'll put a dressing, and then they'll take off the dressing a few days to a week later and then put on steri strips. Some people, they go straight to the steri strips. Some people just have the surgical glue. It really depends on the physician. And then keys to recovery. So a lot of people always ask me how to recover quicker. Of course, it's going to take some time to feel better after you have a baby. This was, 9-10 months of developing this, baby, of having this pregnancy. And of course, it's going to take some time in order for your body to recover, and especially after delivery. So keys to recovery. So these are some keys that I normally recommend my patients to have. Number one is try to drink a lot of water. Try to drink at least a glass of water every time you feed the baby. So if you think about it this way, if you have to drink, let's say 6 to 8 glasses of water per day, and you have to feed your baby about 6 to 8 times based on if they're feeding every 2 hours, every 3 hours, but either way, 6 to 8 times a day. One way that you can help to remember, because if you're a mom like me and you kind of forget these things, you can always drink a glass of water every time you feed the baby. That way it's kind of like a alarm. Oh yeah, that's right. I have to feed the baby. I have to drink my water. And another thing that you can do is walk as early and as often as possible. So the last thing you want to do is stay in the bed all day. I've seen very amazing things in the hospital. Sometimes I've seen where someone's just laying in the bed. Oh, I just had a baby. And there's people like fanning them and all of this. But you want to do is you want to walk. You want to stay active. You don't want to stay in the bed, because after you have a delivery, especially if you had a cesarean birth, the longer you stay in bed, the higher risk you are for blood clots and other complications. So walking as early as possible, drink a lot of water, especially replenish your fluid, and then urinate. Keep your bladder empty, helps reduce the risk of postpartum hemorrhage. It decreases pain, helps overall comfort, and even allows you to walk and take care of yourself and your new baby. So definitely urination is a great thing. What you can do, a big tip, parenting tip for me, is you can always try to pee before you feed the baby. So let's say the baby is supposed to feed every 2 to 3 hours or on cue. What you can do is say, okay, it's about time to feed the baby. Let me go ahead. I'm going to go to the bathroom. Because what you don't want to happen, and this goes for breastfeeding and bottle feeding babies, what you don't want to happen is you're in the middle of feeding the baby's all into it, and you're like, oh man, I gotta pee. So peeing before you feed the baby really helps to avoid that, and just makes you more comfortable, makes the baby more comfortable. And then of course, you're not rushing things to try to go to the bathroom. So you pee, then you feed the baby, and you're sipping that water. And then here's a few nursing secrets that I learned throughout the years. I've been a nurse for quite some time. And if you want to hear more secrets, you can also have a consultation with me. Like I mentioned, the link is in the description. So nursing secrets. Number one, change out of your clothes ASAP. It really is true. When I see people in gowns, it kind of makes them feel like an old man. I don't know why it is, but probably because you're thinking of a gown, you're thinking of yourself as a patient. But you're not an old man, you're a strong woman. And by changing out of your clothes, it kind of changes your perspective a little bit. I mean, you have to be in your gown for a little bit if you want to. Some people like how it's a little bit more comfortable at times. But by changing your clothes, what it does is it kind of switches something in your brain to say, okay, let's go. I am going to be more active. I'm going to get out there, and I'm not going to stay in bed all day. And also what I've noticed is even pain levels are better when my patients get out of the gowns. You would be surprised. It's like, I'll come in the morning, they're in so much pain. I'm like, all right, let's go to the bathroom. Let's try to freshen you up. Let's change your clothes. And it's like an hour later, they're a complete new person. So it really makes a difference. So if you're feeling up to it, change your clothes. Number two is ask when your IV may be removed. So if you need your IV, that's important. Sometimes you might need your IV, high blood pressure, hemorrhage, infection, but normally I'd take it out about 1 to 2 days after you deliver if there's no issues. If your blood results are fine, if your blood pressure is okay, your vital signs are okay, I usually try to take my IVs out of my patients if I can, just so that they are a little bit more, I guess you can say, independent to do what they want to, that they feel like they're more at home. And then it's easier to take care of the baby also, because even holding the baby, if you have an IV in your arm, it can be really, really difficult at times. So you have complete power over your medical care. I just want to say that even as a nurse to my patients, you have complete power over your medical care. So you don't have to feel bad to ask questions. Now, as nurses and medical professionals, we will inform you of, your results, we'll inform you of your plan of care, but in the end, you are the one that holds the reins more than anybody. Our job is to inform you and to give you the best care that we possibly can based on the goals that you have. So we have change your clothes, try to feel at home, try to take off lines if possible as well, whatever, like for me as a nurse, whatever lines that are not necessary, I try to take off. So if my patients are walking, for example, and it's not ordered to have the compression stockings, if it's not ordered to keep them on, let's take them off so you can walk for yourself. It's all about independence. Number 3, shower as soon as you can. One, it's just good hygiene, but you would be surprised how many times I'll have a patient and they don't want to shower. One of the first things I wanted to do after I had my babies was shower. It's just such a magical thing. It makes you feel so refreshed. A good rule of thumb too, when you're taking a shower so that you don't feel too dizzy or anything like that, is if your mirror fogs up, it's too hot. So one thing you can do is you can even leave the door open a little bit. Most hospitals also have this red line that you can pull if you're not feeling too well. So just know where the red line is. It's like it's kind of like a string that you can pull in case of emergencies. And then when to call the doctor. So these are just a few reasons to call the doctor if you have any of these postpartum. Number 1, if you have a fever of 100.4, sometimes engorgement can cause a fever, but it won't cause it to go up too much. For engorgement, you can try to use some warm washcloths as well. Those really help. Or if you do pump for engorgement, just enough for relief. Don't pump too much, because then it will actually make the situation a lot worse. Tylenol helps with fever for engorgement as well. And also try to stay hydrated, because with engorgement also comes a lot of expression of milk. And then the more milk that you're losing, the more fluid you need to replace. So if you have a lot of engorgement, especially if it's causing a fever and it's causing to, it's starting to get bad, you can pump for comfort, but not enough to empty the breast, because if you are emptying the whole breast, your engorgement is just going to get a lot worse. So if your baby is latching on, great. And it does take some time for your milk to regulate as well. If you pass large golf ball size clots or fill an entire sanitary pad in an hour, that is signs of postpartum hemorrhage. So you would definitely call the doctor for that. Next is if your incision starts to have a foul drainage or smell. That is definitely a sign of infection. So you want to try to let the doctor know as soon as possible for that. And to prevent infection, try to keep your incision site clean and dry when possible. Pain on urination or foul smelling urine, those are all signs of UTIs. So especially if you had a cesarean birth and you found yourself with a catheter, you are at a higher risk of having UTI. And also that goes for epidurals as well, if you had an epidural during your vaginal delivery. Next, chest pain, vomiting, difficulty breathing. Those can be signs of blood clots also. So you want to let the doctor know if you have a blood clot. Usually what they'll do is they have different medications that we can give you to decrease the blood clots. And then if you experience thoughts of harming yourself or others, that is also a sign of postpartum hemorrhage. So we finished our postpartum care section of the course. Does anybody have any questions before we go to the next section? And you guys can always let me know if you have any questions, but for postpartum care, just as a review, and let me drink some water here. We talked about vaginal hygiene. We talked about incision hygiene. We also talked about some different warning signs. And if you guys have any questions at all, you can always just let me know anytime. So newborn care, how to take care of your baby. Like I mentioned, I also do have the consultations for newborn care. So what I normally do recommend is to have a consult before you have your baby in your 3rd trimester. I usually say between 32 to 36 weeks to have a consultation, just to make sure that all your questions are answered before you guys have your baby. And then I normally recommend another consultation after you have your baby. Make sure that everything is transitioning okay. And if you had any questions about newborn care or any questions about breastfeeding, bottle feeding, pumping, whatever you might have, at least I can answer all of those. So skin to skin. So skin to skin is one of the best things that you can do to help your child to transition to life outside of the womb. So who can tell me when is the best time to start skin to skin? So how soon after your delivery can you do skin to skin? And it's great because pretty much the earlier you do skin to skin also, the earlier you and your baby can reap the wonderful, wonderful benefits of skin to skin time. But exactly, so the golden hour, or as soon as possible really, is when you want to start doing skin to skin. And you do not necessarily only need to do skin to skin for that first hour. I've seen people that they're like, oh, I already did skin to skin during delivery. But you can do skin to skin as long as you want, even up until days, weeks, months. You know, it actually helps to calm the baby down a lot and has a lot of other benefits for you as well as the baby, especially when the baby's transitioning. And the baby can take a few days to transition, can take 2 days, can take 3 days, 24 hours. Every baby's different, but it does take some time to transition. And the more skin to skin time that you and your baby are getting, the more of these awesome rewards that you can have. So number one is a benefit of skin to skin is that breastfeeding is easier. Of course, the baby's close to mother. She can see those feeding cues. And who knows any early feeding cues? So you guys can just type in, what are some signs that your baby is hungry? This can be, and babies that are bottle fed and babies that are breastfed all pretty much have the same feeding cues as a newborn. So these are very important to know because you want to make sure that you are feeding your baby at early signs of hunger, early feeding cues, and not late signs. So the most common, I guess you could say, answer that a lot of people have, and Jessica's right, is that early signing is rooting. But if you wait too long, what happens is the baby starts crying and it gets a lot more difficult to start nursing and start breastfeeding, or even to start feeding the baby. Even if you wanted to have a bottle feed, if you wait too long, your baby can suck in a lot of air, suck in a lot of just make it, sometimes even suck in too much formula or breast milk than they wanted, and it'll make it a lot more difficult to feed the baby and they'll have more complications. So feed at the earlier feeding signs. So we had rooting is when they start moving their mouths towards a source of contact. So for example, let's say you're breastfeeding your baby and you put the nipple towards the baby's mouth, the baby will start moving towards that sign of contact. You can even do like a little finger test, you know, like if the baby is laying down and you think the baby's starting to root a little bit, you know, if you put your finger here, usually the babies go and they'll try to get your finger, which is kind of funny, but that's all rooting. Or even sometimes I've seen it is really funny where daddies are doing skin to skin and then the baby starts rooting on daddy to try to find where the breast is. And we're like, hey, there's not really anything in there. But and then another one, Samantha mentioned sucking noises. And yes, that is true as well. So babies will even start to smack. They'll start sucking on the lips. Those are all early feeding cues, all early feeding signs. Another one is actually the hand to mouth. So you'll start to see your baby's hands like this. Usually in the beginning of a feeding, whether it's breastfeeding or bottle feeding, babies are usually very constricted. Their body language tells you, when you're very stressed. And if you're very stressed, all of a sudden everything's kind of like this. It's the same thing with a baby. In the beginning of the feeding, usually babies, they're all stressed. Their hands kind of make balls, and they even sometimes have the hand to the mouth. Even when they're on the breast, usually you'll see them on the breast. Maybe, they'll have their hands like this, and then they'll keep going like this, opening and closing. That is normally towards the beginning. And then as they finish their feeding, they'll start to calm down, relax, and they'll have a much more relaxed body posture. And then that's how you can also tell that that's towards the end of the feeding. So another early feeding cue, so we mentioned rooting, we mentioned sucking, we mentioned hands and mouth, we mentioned the body posture. Another one as well is called REM eye movement. So if you, and I have glasses here, but when you close your eyes and you see the eyes moving from within the eyelids, that is actually one of the sleep cycles right before the babies start to wake up. So if you start to see even the eyes moving underneath the eyelids in that REM sleep cycle, that's usually the sleep cycle before they wake up, and it's a great, great time to feed your baby. So before you feed your baby, try to change their diaper. You don't want that diaper to be sitting there for too long, and especially newborns, their diapers sometimes babies don't always wake up when they have a dirty diaper. So that's something that you would want to check on regularly for them, because babies that are newborns, they're always thinking about one thing at a time. If they're hungry, they're hungry. If they're sleepy, they're sleepy. If they're dirty, and that's it. But what happens if they're sleeping, they have a dirty diaper and it's almost time to wake up. They're only thinking about one thing at a time, and it's up to you to say, okay, they're sleeping, but they're starting to wake up to eat and they have a dirty diaper. In their heads, they're just thinking, okay, I'm tired, let me sleep. But it's up to us to be able to speak in and be like, okay, let's change our baby's diaper and start this feeding. Number 2, another thing with skin to skin is helps the milk let down for breastfeeding. So there are different hormones that are taking place as you are nursing and breastfeeding. If breastfeeding is on your list of what you want to do, if that is, and actually how many people are breastfeeding your babies? That way I can kind of get a gauge. But if you are planning on breastfeeding, you can let me know as well. Then I know I can focus. If you are planning on pumping, like pumping exclusively is a thing as well, or you can even say what you're feeding. Okay, so we have quite a few people. You can just say what your feeding intentions are, and then we can go from there to hopefully try to get everybody at least a little bit of tips for what you want to do. So for our breastfeeding, at least the skin to skin time really helps for the breastfeeding. It helps with the letdown. It helps with the hormones. What happens is one of the very big hormones of breastfeeding is oxytocin. Oxytocin is the letdown hormone. So oxytocin is released when the nipple is stretching during breastfeeding, during nursing, the oxytocin is released. Another time that is released is by breast compression. So as the baby is skin to skin with mommy and your body feels that breast compression, starts feeling the touch of the baby, your body is releasing oxytocin. Therefore, it is starting to let down that milk. Another one's prolactin. Prolactin is the milk producing hormone that is released as the milk is emptied from the breast. The more the milk is emptied from the breast, the more prolactin is released. The more prolactin is released, the more milk you produce. So it's kind of like a whole cycle there. Another thing of skin to skin is it helps to keep the baby calm, less crying, and it keeps the maternal infant bond as well. Babies, they have a kind of a whole scenario of what they usually do. The first about 2 to 4 hours, they're very alert. They're very active. That's a great time to start nursing, even especially in that 1 hour where it's their golden hour. That's perfect. Then after that, they start to calm down. You'll start to see about 12 to 24 hours of hibernation. That's when they're like, oh man, I spent all of my energy in delivery. I spent all of my energy in the first 2 hours. Now I'm done. Let me just sleep. So then they sleep for about 12 to 24 hours. That's when you have to wake them up to feed. You have to wake them up. They're so tired. Then they start getting, especially in that second, third day, they start to have, especially that second night syndrome, if you ever heard of that, or I call it the fiesta time, where they just wake up and they're like, all right, let's make up for last time. And that's when they start cluster feeding. That's when they start kind of crying, especially at night. They're more awake. During the day, they're a little bit more sleepy because they have to change that whole scenario. So especially at night, they start crying. what it is actually an overactive CNS system. If you remember the central nervous system from high school or college or even middle school, you remember the central nervous system. If their neurons are firing like crazy and their central nervous system is on overload. So when that happens, then that's why that whole second night syndrome starts taking place. It's that overactive central nervous system. So what skin to skin does is it chemically and hormonally, whatever, hormonal and chemically starts to calm down that central nervous system, therefore helping to alleviate that second night syndrome and keeps the baby calmer and helps with that strong maternal infant bonding. It just overall just makes it so much easier. And what you can do also is you can even alternate between mom and dad. So let's say it's a very long night. What I usually recommend is, let's say mom feed the baby, dad sleeps. Then after the feeding's done, mom can hand the baby off to daddy. Daddy can burp the baby. Daddy can have the baby for a little bit. Mom sleep. You set an alarm, see if the baby, wakes up within that first 2 to 3 hours. Daddy hands off to mom, and you guys can take those turns, because if both of you guys are up, especially during that second night, it's going to be really difficult. What you can do also is try to sleep as much as you can during that first day. That way, when the baby wakes up that second day, it's not as shocking to you guys, because at least you kind of prepared yourselves physically and mentally. So another benefit of skin to skin is it helps with blood sugar and temperature is controlled better. So actually, that's one of the things that I do when I have a baby whose blood sugar is kind of having trouble to regulate, or even if I have a baby whose temperature is not really controlled that well, especially if you have a small baby who doesn't have that much brown fat, or if you have, let's say, a mom with gestational diabetes that the mom has been giving the baby all these supplies of glucose from her diabetes, but then the baby comes out, doesn't have that constant supply of glucose, and then that baby's blood sugar plummets. So what I do, especially if you have gestational diabetes, or if you have other risk factors for your baby to have low blood sugar, do skin to skin as much as you can and as often as you can, because it does regulate your baby's blood sugar. So especially if you have a smaller baby, or if you even have a premature baby, the earlier you do the skin to skin, if possible, the better. Temperature is controlled better as well. If you think about it, it's like, what happens to your body temperature if you have a warm blanket? Your body gets warm as well. So of course, mommy's skin is going to be a lot warmer than a blanket. So that's why skin to skin really helps with the temperature. Breathing regulation for the baby is actually, when I was going through the research, that was one of the really interesting things, that it actually helps with respiratory distress. So I thought that was really interesting. Lowers mother's blood pressure, which makes sense, because as mom is calmer while doing skin to skin, mom's blood pressure is regulated as well. Decreases risk of postpartum depression, and actually overall shorter duration of hospital stay. Because of course, if you don't have all these complications, you're not going to have an over exceeding amount of days in the hospital. So I thought these were fantastic. So for those of you who are watching now, what is your favorite, or what is the most exciting benefit of skin to skin? Maybe one that you did not know before. But I did a lot of research into this list of the benefits of skin to skin. I thought it was really interesting. I think one of the most interesting ones for me that I think can have a lot of application is for the blood pressure personally. But if you have a favorite one or something that you thought was interesting, you can also share it below. But I think one that is really interesting is lowering blood pressure, because I've seen what happens when moms have preeclampsia or eclampsia and their blood pressures go way out of whack. I think it's really interesting that doing skin to skin actually can help with blood pressure issues. And then of course, to kind of help to prevent seizures and all of those. Breathing regulation. I know, right? It makes sense. Now that you think about it, you're like, oh yeah, breathing regulation. It's interesting how doing skin to skin can even help with respiratory distress for infants, especially if you have a premature baby that's, apt for all these complications. It really helps with that. So we have diaper changes, and I include basic baby care in this class because I found that a lot of people had questions, not only about breastfeeding and everything, which is great, but also about just basically how to take care of a baby. Actually, the other day I did a consult with somebody, and the reason for the consult, they wanted me to do an in-home consult. And the whole reason was that they just got back from the hospital and they didn't know really how to take care of the baby. I guess maybe the nurses did everything for them. They were like, we just need a run through on how to do a basic baby care. So the main reason I actually saw them was I went over diaper changes. We even went over bathing the baby. We went over even like milk storage and all those basic baby care of even like how to we went over like infant massage, a lot of really cool stuff, but that's great. So my consultations are not just for breastfeeding and feeding, but they can be for anything. Kind of a jack of all trades here. But yeah, and shorter hospital stay, I think is fantastic as well. So diaper changes, these are some basics of diaper changes. And then if you have a boy or you have a girl, I have a little bit for each one. But number one is put a new diaper underneath the old one. That's actually a huge nursing hack and a mom hack actually, but put a new diaper underneath the old one. That way you can kind of just use that old one, tuck it in, and you have that new one there that when you take that old one off, all you do is pop it right up and that's it. Especially if you have boys, that it's natural for them when their bodies hit air that they start peeing. So, and if you have a boy, go, but you want to stay outside the line of fire. But what you can do is have a new diaper, and then when you take off the old diaper, at least you just put the new one right on there. The flaps go on the back side, not the front. So you can kind of see a picture here. The mom has the baby, just strapping those to the front. There's like a little line here. I'm not sure if you can see it, but usually diapers have a yellow line that changes to blue when there's pee, but it does not change when there's poop. So that's one thing to keep in mind. Another thing also is that if you have a baby with a circumcision, you want to make sure that you have, they'll teach you how to clean it, but we can also, if you do have a circumcision, you want me to go over things as well, we can go over that as well. But you'll have gauze, you'll have Vaseline. What happens is the layers of the gauze sometimes prevent you from seeing when there's pee. So one thing that I've noticed is if you have a baby boy with a circumcision, you want to make sure that you are actually checking the gauze to see if it's wet, because sometimes that line does not change to blue. And that's a huge tip I give to my parents. And they're like, wow, I didn't even think about that. That's a good point. And then I use a clean wipe. You don't want to use a dirty one, of course, but what you can do, you don't have to use 20 different wipes. You can fold it, use it, fold it, use it, but you want to make sure that if you have a baby girl, you're doing the front to back to reduce infections. And then baby boys, you always want to clean underneath the testicles. Sometimes you'll find that the testes are a little bit more swollen after delivery. Don't be discouraged by that. Usually it goes down on its own. Even the vaginal area for baby girls are sometimes very swollen as well. Those all do come down with time. It's just extra edema from childbirth that goes down, and you don't have to do anything for it. The doctor will just make sure that the testes are descended, because sometimes babies that are born and their testes have not descended into the testicles, but you'll see that when they're really swollen, sometimes you can't feel it because they're so swollen, but they're still there. If that happens, where the testes are very swollen and they don't know if the testes have descended into the testicles yet, they might do an ultrasound. But don't be discouraged if they don't find it, because sometimes it takes some time to descend, or sometimes it's there, it's very swollen, and that's why they couldn't feel it. And then don't be discouraged if the baby poops or pees more as you're changing, happens all the time. So that's why that new diaper really plays a role, try to keep that as quick as possible. And then 8 is make sure that all of your diaper changing supplies are next to you. So especially if you are doing a circumcision also, what I do is I actually even get the gauze and the Vaseline all set up. So I'll have my gauze, I'll have my Vaseline, I'll put the Vaseline on the gauze, I'll put it to the side so it's already ready. That way, the baby's not exposed for too long. And then those are my diaper changing hacks. Feeding your baby. So the first step to making the decision to feed your baby is to research. Sometimes, and everybody has different plans. Some people want to breastfeed just in the hospital. Some people want to go straight to the bottle. Some people just want to go straight to formula. Some people want to exclusively pump. There's 5,000,001 ways that you can feed your baby. And there's no right or wrong way, as long as you are following research-based practice and you are feeding your baby as safely as possible with the method that you have chosen. So, of course, there's exclusive breastfeeding at the breast. There's exclusive breastfeeding with direct breast, and then some pumped express milk. So let's say if you need to supplement baby's jaundice or something like that, you might choose to use your own breast milk. Sometimes you have to supplement and your own milk is not available. Maybe you might have to supplement with formula. And all of these are just different scenarios, some breast milk, some formula, and it all depends on what you want to do, what you wanted to do. So exclusive breastfeeding at the breast, obviously it's free. It reduces the risk of SIDS. And this PowerPoint, by the way, is on the Eventbrite online page. So if you did not sign up for this class directly, if you just kind of logged on and saw it, you can sign up for the next class on the Eventbrite link. Well, it'll say on the description, sign up for the next live class. And you'll be able to see this from the online event page when you log in and you see all of the information. That's just Eventbrite. And then it has, that's another YouTube video. If you have not subscribed yet to my channel, by the way, I would really appreciate it. At least we have a lot of great videos about breastfeeding, about prenatal care, about childbirth. And I mean, you pretty much can sit here and watch videos all day. I have a lot of great resources for you guys. And then, so it's free, reduces the risk of SIDS, that's sudden infant death syndrome, less chance of ear infections, less colic and gas, better microflora in the stomach as well. So your stomach actually handles a lot of immunity. So the better the microflora of the stomach, the pretty much the healthier and the more immunity that your baby has. So one great thing is that it coats the stomach with all of those good bacteria. And pretty much if you think about it, when the baby is nursing, the baby is not only getting breast milk, but the baby is also getting your microflora. So that's why it's very important, not only for the baby's diet, but your diet as well. So if you are breastfeeding your baby, you notice your baby starts having troubles with the tummy or something like that, your first step is to check your diet. Is it something that maybe you are eating that your baby does not really respond well to? Sometimes it can be lactose, sometimes it can be high caffeine, sometimes, it can be a million different things. But you can just look at your diet, and some good breastfeeding foods would be stuff like avocados. You have pretty much all of your healthy stuff. You can have your legumes, your beans. You want to have even quinoa, whatever the people are eating these days, all of that. Those are great things to have for breastfeeding as well. Tips, skin to skin as much as possible. Make sure you have a good latch. Now I have a video there when you are checking, when you're looking at the PowerPoint, but I'm just gonna show you really quickly with my kid's bear. Now this is Mateo's, he's my almost 5-year-old's bear. He's had this forever. So with our baby, remember, we're checking our early feeding cues. We are checking for the rooting. We're checking for the sucking. We're making sure our diaper is clean, and we are putting our baby skin to skin. What I find is that a lot of people, they wrap up their babies like the burrito, and they'll try to put the baby to the breast, and the baby's like all the way out here, and they're trying to go like this and feed the baby. And they wonder why the baby is not latching well, because the baby is too far away to have a deep latch. Therefore, you want to have skin to skin. First step is belly to belly, so you guys can see a little bit better. So we have belly to belly. I'll see a lot of people kind of try to feed their baby like this and cradle, but then as you can see, the belly's up like this, and if the baby needs to eat, it's going to be like this. That's really, really awkward. Doesn't really work that well. So belly to belly. And there's different positions you can try. This particular one's called the cross cradle. So what I'm going to do is I'm going to use my forearm to support the baby's back. And then the feet are gently tucked here and supported by my elbow, because baby really really likes to have their legs supported by that. So then what you do is you have the belly to belly, you have the baby supported with the legs. Then I'm using my kind of the palm of my hand to support that back and neck. And then I'm using my fingers here on both sides of the ears, and I'm going to use my outside hand. The fingers go underneath the breast, and then I'm going to make a C position. And then nose, not mouth, nose to the nipple. And then I'm going to express a little bit of colostrum. Now, hand expression is you actually reach behind, so you go back and then out. You just don't go like this, but you actually reach back towards your receptors and then out. Nose to nipple, and then when the baby makes that wide gape, then that's when you latch the baby on. Then you, usually with newborns, you kind of have to hold that position for a while because they kind of get a little aggravated if you move their position on them. But if we do a consultation, like I said, you have on the description the link for our free meet and greet, so we can develop your educational plan. We can go over 5 million different latch positions if you wanted. That's really my favorite, but it's actually really interesting to know different ones, because the more latch positions that you do, different latch positions actually empty different parts of the breast. So actually when you rotate your latch positions and you rotate the baby, it actually helps to release engorgement, and it even helps with your milk production, because obviously you're not keeping the baby in the same position all the time. Now, this will be our last slide because we're almost running out of time, and I know you guys are going to miss me so much. But so alternatives to direct breastfeeding. So if you cannot breastfeed at the breast, or let's say it's not your plan to, you can always pump. So you can start pumping. Pumping is the best way to stimulate the breast. Let's say there's separation between you and the baby. You want to start pumping between 1 to 6 hours to help to stimulate the breast and keep up with that milk supply if the baby's not available. Or if you're not feeling well and the baby's in the nursery, maybe you can have some help and get started with a pump as well. But the pump in the first few days is not really for milk supply. It's for milk stimulation. So it's for the production to be stimulated. So you won't really have much supply out, just because also the colostrum is very thick. Doesn't really come out very well with a pump. Formula based on parental choice as well, availability of mother, hydration of baby, sometimes jaundice levels are up, things like that. Bottle feeding tips. I think it's really important to know how to feed a bottle as well, whether you're planning on bottle feeding breast milk, bottle feeding formula, whatever it might be, donated breast milk, whatever floats your boat. Make sure one thing that you can also look into is paced bottle feeding, where you are holding the baby. So you offer the breast first, then supplementation if you wanted to do both. And then what you can do is you hold the baby. So I'll see a lot of people, they'll try to bottle feed like this, and they'll hold the baby almost completely flat like this, and the baby starts choking over everything. So what I do is, instead of holding the baby completely flat, actually you can use this hand and hold the baby upright like this. And then you can feed the baby the bottle, and the bottle should be almost parallel to the floor like this. And you can feed the baby the bottle like that. You can even support the chin a little bit and feed the bottle. That's a NICU trick right there, but that really does help. So let's see. I wanted to do a little review, and then from the people that are active in our review, one person will be lucky enough to receive my Childbirth Masterclass, which is a month-long prenatal class and newborn care class, absolutely free. So I'm just going to ask a few questions, and then we will do the drawing for the giveaway. And anybody, and the person that won, you can email me. I'll give you the instructions to claim your class. And anybody who wants to register, I just wanted to say also, thank you so much for taking the time to take this class. I know that time restraints, of course, are very important for you guys. Your time is important, so I appreciate your time. And I also started putting in, some people were asking about the link, if I can review the teacher and the class for the live classes. So I put the link on the description as well to review this class. If you feel that these resources have been beneficial to you and you would like to say thank you in any way, or you would like to show your support, on the description, it has a little star and says you can review here. It's just a Google review of Mommy Did You Know? And I would so much appreciate that as well. And then on the description, you'll also see the links to sign up for a consult. You'll see the link to sign up for the next live class. And you'll also see the link to sign up for the free online class as well. That's a self-paced class that you can take. So lots of resources for you guys. So let's test your knowledge and see if you guys were listening. What are some things to expect after childbirth? So this is for your postpartum care. Remember, we talked about a few different things to expect after you have your baby. Now this is, we talked about fluid imbalances causing some changes. We talked about bleeding. We talked about lochia. So let's see if people remember some things to expect after you have a baby. And you guys can type so that I can make sure that you guys are paying attention. Correct. So we have shivering. We have also some mood swings. We also have bleeding. So all of those are things to expect after childbirth. Now, another really important postpartum care question is, what are some keys to recovery? So hopefully you guys remember what were a few of the keys to recovery. What are some ways that you can recover quicker after childbirth? What are some ways to help you kind of get back on the right track after you have a baby? We mentioned three very important things. And let's see if you guys remember. But I did mention walking, walking frequently. I mean, I did mention a lot, but we mentioned walking a lot. Try to walk as early and take a shower. Oh, good. So Jessica really was paying attention. Samantha, you guys were definitely paying attention. So take a shower, change into your own clothes, walk. So all of those, and definitely drink water. Water was the other one. Now, newborn care. We talked about skin to skin. We talked about breastfeeding. If your choice is to breastfeed, what are the steps to latch the baby? So I just demonstrated with my son's teddy bear a few different steps to latch the baby well. We talked about skin to skin. We talked about a few different things. I'll let you tell me. What were the different steps to latch the baby well? By the way, I did not mention signs of a good latch and signs of a bad latch. For a good latch, you want to make sure that the mouth is open, wide. You want to make sure that the baby's lips are flanged out. Okay, those are signs of a good latch. And you want to make sure that you see sucks as well as swallows. So those are all signs of a good latch. A good latch will maybe feel like tugging, but you won't feel pinching. If you feel pinching, that's probably a bad latch. Another is the signs of a bad latch will be the nipple as well. The nipple should come out pretty much the same shape as it did before the breastfeeding session, just maybe a little bit bigger, but it should have the same shape. If it comes out looking like a tube of lipstick, it probably was a bad latch. So those are different signs of a bad latch. But the steps to latch the baby, we talked about skin to skin. We talked about changing the diaper, putting the baby belly to belly, and then nose to nipple. And then when the baby opens nice and wide, we can latch the baby right on. Do I have anybody that has any questions before we begin? Or you guys can share what was your favorite thing that you learned in this class so far. So we learned about quite a few different things. And then let me see, the people that were active. Didn't Jessica win the Did you win the last? I think you won the Masterclass one time. I forgot if it was you or somebody else. But so Samantha and Jessica, I guess it's up to you guys. And you know, I'll just give both of you guys because both of you guys have been very active today. Yeah, okay, cool. So it was you. So Samantha, you won then. I was gonna give both of you guys if you didn't win it because I'm not nice, I guess. So Samantha, you won for today. So what you can do is where you can email me and sign up for the free childbirth masterclass, like the free class. Sign up for that and then email me the email that you use to sign up for your class, and then I will manually put you to the full class. So all you have to do is sign up for the regular one, and then I'll upgrade your membership to the full. So pat on the back, congratulations, Samantha. You have won the free childbirth masterclass, and that's the 26-day class. So congratulations. You are very, very welcome. So, and if you have questions about that, you can email me at mommydidyouknow@gmail.com. So thank you everyone for watching. I hope you guys enjoyed this class, and at least next week we're going to be going over childbirth again because there's just so much information to go over. So I had to divide this into different sections. I'm really happy that you guys enjoyed this class. You always can sign up for review consultations. Thank you so much for Jessica for all of your nice words and staying active in the class. And you always, word of mouth is fantastic because I do have my own private practice. And the best way that we can help to support each other is if you do know anyone who is pregnant, expecting, you can always refer them to me. And I do speak Spanish and Portuguese and English as well. So if you have anybody that would like some resources, but there's not that much in their language, you can let me know also. And you can always email me, mommydidyouknow@gmail.com. You can subscribe to this channel, because I have a lot of great videos as well. So I hope you guys have a wonderful rest of the day. Please let me know if you have any questions, okay? And congratulations, everyone. And I wish you all the best.